Hey there, I'm Blake from Ring Rescue and welcome to the compression device training session. I'm going to teach you everything you need to know about the compression device, plus a little bit extra. Rings are designed for a snug fit around one's finger and it doesn't take much to get one stuck. We created an innovative solution, the Ring Rescue compression device, to help professionals like you solve this problem. The device decreases the need for ring cutting by shrinking that finger down to more manageable size, giving you the best chance to remove the ring and help preserve that sentimental property. It's Ring Rescue plus you equals success. The device shrinks the finger 100% of the time, and then it's up to you to manipulate the ring off of the finger with the techniques we're going to show you today. When people initially use the compression device, they start off seeing between 50 to 60% success rates in removing the rings intact. However, once they've watched this training video and they've done a couple ring removals on their own to know what to look out for, they see their success rate skyrocket to 80 to 85% in removing rings intact. All right, the first thing you're going to need to do is assess the patient's finger, and then you're going to ask them a couple questions. This is going to help you understand how many rounds of compression you're going to need to do based on the case at hand. Pun intended. All right, so the first question you're going to ask the individual is how long has the ring been stuck for? In instances where the ring has been stuck for less than 2 weeks, you've got yourself what we call an acute case. Because you're dealing with more fluid in these cases, one 5-minute round of compression will be enough to displace the fluid and shrink the finger down to a more manageable size to give you the best chance to remove the ring. Most of these cases you'll see are often caused by a recent injury, allergic reaction, pregnancy, or certain medications that can cause immediate swelling in the hand. These cases tend to look like a magic trick because you start out with an extremely swollen finger and the device shrinks it down significantly. Like this one, for example. Alakazam! Now, if the ring has been stuck for over 2 weeks, which could be months, years, or even decades, we define that as a chronic case. In these cases, you're going to need to go to 2 to 3 rounds of compression for 5 minutes each. In these instances, you're often dealing with tissue rather than fluid, and it's more difficult to compress tissue than it is to displace fluid. Usually, chronic stuck rings are caused by weight gain or the development of arthritis over time. Now, there's a third scenario, and that's what we like to call the angry finger. So our next question we're going to ask the individual will be, have you tried any at-home removal techniques? If the answer is yes, you likely have an angry finger case on your hands. This is when someone is at home and they have a stuck ring and they get anxious or nervous about it because they can't get it off. So then they head to YouTube and attempt one of the techniques that they find, such as lubricating with soap and water, butter or olive oil, or wrapping the finger with dental floss. But if the individual has tried the dental floss technique, sometimes called the string wrap technique, you will likely have an angry finger scenario on your hands. In this case, it doesn't matter how long the ring has been stuck for, you will need to do at least 2 to 3 rounds of compression at 5 minutes each, treating it similar to a chronic case. The reason we call it an angry finger is because the string wrap technique causes high point load forces as the thin material is wrapped tightly around the finger. This can cause tissue damage, chance of laceration, more swelling, and for the finger to be sore and raw, which will make it much more difficult for you to remove the ring. If possible, we recommend that you ask the individual to allow the finger to heal for 1 week and then come back for you to attempt the removal. This will give you a much better chance of removing the ring without cutting and will make the process more comfortable for them. It's not compressing the finger with the device that will be uncomfortable, but manipulating the ring off of the finger may cause discomfort due to the damage to the finger caused by their at-home attempts. If they are willing to do this, remind them that if the swelling gets worse, they should go to the nearest emergency department immediately, as they could be at risk of finger strangulation. If the individual isn't willing to wait or the individual has returned after allowing the finger to heal, as mentioned earlier, you need to start with a minimum of 2 to 3 rounds of compression at 5 minutes each. This will give you the best chance of removing the ring without cutting. The angry finger scenario often brings up another commonly asked question, which is, are there any cases where you won't be able to remove the ring non-destructively? And the answer is yes, there are. For instance, if there is severe osteoarthritis present in the knuckle bone, you may not be able to remove the ring non-destructively. This is because if the knuckle bone grows larger over time than the ring, we're not going to be able to pass that ring by it. We can't compress bone. But what we can do is compress the tissues around the knuckle so you can fit a ring cutter in more easily, which makes it more comfortable for the patient. Another instance where removing the ring intact may not be possible is in cases of severe weight gain. In these cases, you'll likely notice a fat pad that has built up over time. As This is very difficult to compress and you may not be able to get the ring over this area. But as I mentioned before, what our device can do in all these cases is shrink the tissue around the ring to allow more room for a ring cutter to be placed underneath the ring, making for a more comfortable process for the patient. Okay, I know that was a lot of information, but let's recap the basics. Acute case is when the ring has been stuck for less than 2 weeks, and this is where we're going to use 1 round of compression for 5 minutes. Chronic case is when a ring has been stuck for longer than 2 weeks, and we're going to use 2 to 3 rounds of compression at 5 minutes each. Angry finger case, very similar to a chronic case, we're going to use 2 to 3 rounds of compression at 5 minutes each, no matter how long the ring has been stuck for. And in some cases where you may not be able to remove the ring non-destructively is in injured finger scenarios, osteoarthritis, or severe weight gain. But remember, even in these cases, our compression device can still compress the tissues so that you can fit a ring cutter in more comfortably for the patient. Now that we've got those unique scenarios nailed down, let's get back to the procedure. Now, after you've assessed the finger and you understand how many rounds of compression you'll need, it's time to put on your gloves. We initially provide you with textured gloves in the kit to get you started. Gloves are important because they help provide traction and grip with those smooth bands, kind of like mine, especially when you get the lubricant on the ring. Let's push the ring back to the base of the finger so the device can be applied to as much of the swollen area as possible. Place the device over the maximum area of swelling as close to the ring as possible. At this point of the process, if you have an anxious individual, we recommend that you apply the device to a finger on the patient's non-affected hand to show them how the device feels. This will make them feel more comfortable and at ease with the whole process because they will know what to expect. Do not place the device over the ring because the ring will actually block the bladder from compressing the tissue, and any settings on the ring could puncture the internal bladder. Now it's time to begin compression. All right, let's have a look inside where you'll see that there are 3 contact points inside the cuff. This was purposely designed so that you can line up any irregular shaped rings or a solitaire diamond to get the internal bladder as close to the ring as possible. Now you can start to inflate the device by turning the valve closed in a clockwise motion. Inflate the device until you find the dial in what we call the target zone, which is that light blue area on the gauge. Once you've fully inflated the device, now is a good time to check the position of the cuff to see if we are as close to the ring as we can be. When looking from a bird's eye view, you might believe that the cuff is as close to the ring as possible, but take a peek down the barrel and you might notice that you can move it even a little bit closer to the ring. If there is still space between the ring and the compression device, simply deflate the device and reapply in the proper position. From there, have the person elevate their hand to a 90-degree angle. If there's a table nearby, they can rest it on it if they like. As the device is compressing the finger, you may see the dial fall out of the target zone. This is happening because as the finger shrinks, less pressure is being applied, but we want to ensure we keep up that consistent pressure. Simply pump up the device slightly to get it back into the target zone. While the finger is being compressed, you may see the tip of the finger turn purple. This is completely normal and to be expected, and once you remove the device, this will return back to normal. The compression device shouldn't be causing any discomfort to the individual, so if they're experiencing pain throughout the process, this likely means something else is going on, like an injury to the finger that you might have missed in the initial assessment. After 5 minutes, deflate the device by turning the dial counterclockwise and remove it from the finger. If you're dealing with an acute case, this will likely be enough to shrink the finger down to a more manageable size to give you the best chance to remove the ring. But let's pretend we're dealing with a chronic or angry finger case. Because you know that these types of cases will be more difficult, you're going to need to use 2 to 3 rounds of compression at 5 minutes each. After the first round of compression is complete, you'll notice that the finger is smaller, but you'll see there are lines on the finger created by the seams in the bladder. So now we need to work to even out those seams to optimize compression. You're going to want to deflate the device, pull it off for just enough time to give it a quarter turn in order to shrink those lines. At this point, there's no need to assess the finger because you're going to need another round either way. Once you're done with the second round of compression, this is where you'll take 5 to 10 seconds to assess the finger to see if you think another round is necessary. If you do decide to go for a third round, do another quarter turn. This will further optimize compression and give you the best chance to remove the ring. All right, now a couple tips on the compression portion of the procedure. We want to emphasize that it's most effective to do all rounds of compression at the beginning of the process instead of, for example, doing 2 rounds of compression, manipulating the ring for a couple minutes, and then doing a third round of compression. If you are considering another round of compression, don't second guess yourself. Do another round. It can't hurt, especially if you have time and it's your first time using the device. A question we often get is, how many rounds of compression are we allowed to do? Now, while this is the exception to the rule and only necessary in severe cases, you can use up to 4 to 5 rounds of compression, not because more compression is unsafe, but because after that amount of compression, it is unlikely that the finger will shrink any more than it already has. Now that we've optimally compressed the finger and have removed the device, it's important to not pull or tug on the ring, as this will aggravate the finger and counteract what we've done slightly. Remember, you have time. Do not rush. You have about 3 to 5 minutes before the finger is going to swell up again. If after 5 minutes of manipulation you start to see the finger swell up again, that's okay, just add another round of compression to help you with the process. The next step is to apply our special non-hydrating hypoallergenic lubricant. Just so you know, this can be used on patients ages 3 and up. Many other lubricants are hydrating and actually absorb into the skin, which will cause the finger to increase in size slightly, which will counteract what we just did. However, our lubricant is non-hydrating, so it sits on top of the skin, which doesn't increase the size of the finger, ensuring it's working with you, not against you in ring removal. When applying, do not apply it to the entire finger. Too much lubricant will make it really difficult to grip the ring. You will only need a few pumps in front and behind the ring. Then, start to spin the ring in one spot to work that lubricant underneath it. If you're able to spin the ring in one place, this means you have enough lubricant. Remember, you can always add more lubricant as you work on removing the ring, so don't overdo it at the beginning. If you feel like the ring is too slippery, no worries. Just wipe some of the excess lubricant off the top of the ring with a towel to give yourself better grip. All right, now it's time for the fun part, removing the ring. Let's get into our manipulation techniques that have helped to remove thousands of rings around the world. These will give you the best chance to remove a ring non-destructively. So let's get into it. One of our most successful techniques is what we like to call the corkscrew motion. Now is the time for you to start that rotational motion in an attempt to rotate the ring off of the finger. Next, if meeting resistance from the tissue, you can attempt what we like to call the rocker technique, which is walking the ring off of the finger in an up and down and side-to-side motion. But remember, don't rush. It's slow and steady, millimeter by millimeter. Another useful method is the claw technique. This is when you put your hand in a claw or C shape, place it behind the ring, and use your fingertips in a rocker motion to work the ring down the finger. If you're still meeting resistance, another effective technique is called countertraction. To get started, you're going to want to take a towel or paper towel and dry the base of the finger. Then, with your non-dominant hand, you pull the skin back towards the base of the finger while slowly progressing the ring off while using the rocker, corkscrew, and claw techniques. This works the buildup of loose skin underneath the ring and helps you progress it slowly down the finger. If you've got the ring just over the knuckle and you're still just hung up on that last bunch of built-up skin, push up on the bottom of the ring and have the person bend at the knuckle to a 30-degree angle. It changes the angle and stretches that loose skin to help you get the ring over that last little bit. After successful removal, make sure to remind the patient to not put that ring back on. I know this seems like a no-brainer, but believe it or not, we've seen patients put their rings back on right in front of us. In tough cases, such as chronic cases or the angry finger scenario, which we talked about earlier, manipulation is going to take a little while. You may get to a point where self-doubt starts to creep in and you think you're not going to get the ring off, but have confidence in yourself. Keep in mind, you can add more lubricant to help you throughout the process if you need it. And remember, slow and steady. If you and the individual are both motivated enough, you're likely going to get this ring off. To care for the device, use a disinfectant wipe and wipe down all surfaces of the device and then place it somewhere to dry. Once the device is fully dry, place it back in the case. Do not submerge the device in liquid or autoclave. Here's some scenarios to watch out for before you use the device. Severe laceration. With severe open wounds, you may need to revert to another solution, as we don't want to damage the finger anymore by going through the manipulation techniques after the device has been removed. So please, use your best judgment in these cases. Severe injury to the finger. If the finger is broken, fractured, or the individual is experiencing pain, the compression device won't cause any additional discomfort. However, the manipulation of the ring might. That's it. Now you're ready to take on any stuck ring cases that come your way. Thanks for watching our long instructional video to help you rescue rings and preserve that precious property. If you've got any questions at all, you can email us at info@ringrescue.com or DM us on any of our socials.